Preview.
Well, good morning and thank you very much for having us. We are from Plymouth Hospitals and we would like to share our innovation in histopathology, specifically with the improvement of cancer diagnosis. Our innovation is based on lean principles. We identified 3 different streams of work, the green stream, yellow stream and red stream. And we established flow in the laboratory by reducing carve-out and moving towards a first-in, first-out reporting system. We schedule tasks throughout the process, and we also collect meaningful data and present this data in a useful way. What was the challenge that we were up against? We had more than 500 unreported cases in our labs, turnaround times of 2 to 3 months. There was a delay in the diagnosis of many cancer cases, and this led to critical incidents in the trust because of delayed cancer diagnosis. To remind ourselves that the critical incident has a patient at his end, there's just one of many, a male of 64 years, Mr. M.E. He had a lesion removed from his finger by his GP. It was submitted to our laboratory but was delayed in our backlog. When it was finally diagnosed, it was a diagnosis of malignant melanoma and it was infiltrating bone. There was a 9-week delay in the diagnosis of a potentially fatal neoplasm. Of course, there's been previous attempts to rectify the condition. Many reviews, internal reviews, including my own, external reviews and involvement by the service improvement team. These reviews focused on the mismatch between demand and capacity. And that is true. We do have a capacity problem in our laboratory in terms of staff. However, we realized in the current financial climate that it is unlikely that all vacancies will be filled, and we had to find ways in working differently and delivering more with less. What are the national baselines that we are measured against? The Royal College of Pathologists and the NHS Improvement both independently published baseline data for turnaround times in histopathology, and these indicators look at the percentage of biopsies which are reported within 3, 7 and 10 days. So how did we measure against these? Our 3-day turnaround time was 15% instead of 50%. Our 7-day turnaround time for biopsy cases were 38% instead of 80%. And our 10-day turnaround time for all cases was 48% instead of 80%. So more than 100% below national baselines in some cases. So we had to change, and Madeline is going to tell us about the hard side of change, what we did, whilst Carol is going to look at the soft side, the team engagement.
Historically, the way we've worked in the laboratory is to prioritise the complex consultant cases. However, these require a large proportion of technical time and therefore delay many diagnostic biopsy cases. The aim of our innovation was to form 3 streams of work, green, yellow and red, to be determined by the amount of technical time required. The red stream cases produce a large number of paraffin blocks and require a large range of technical complex staining techniques. The yellow streams are small biopsies and small excision specimens requiring a moderate amount of technical work, each case typically producing one or more paraffin blocks and subsequent levelled H&E slides. The green stream cases, again are small biopsies and small excision specimens requiring the least amount of technical work, each case typically producing one paraffin block and one H&E slide. Included within the green streams are not only previously unprioritised basal cell carcinomas and squamous cell carcinomas, but also many clinically undiagnosed malignancies. The streaming process first begins in the cut-up area of the laboratory, where the green streams are segregated. To improve efficiency in this area, a digital template system was designed. This allows for instant embedding of the macro description and was a pivotal process in the adoption of a voice recognition reporting system. In the main laboratory, a member of staff is designated each day to deal with the green stream cases. They have a target time of 9:15 to have 20 cases ready for reporting. A scheduled consultant then has a target time of 12 o'clock to have those 20 cases authorised. To improve efficient workflow through the laboratory and to encourage a first-in, first-out ethos for the yellow stream cases, a visual control system was implemented. and in conjunction with the implementation of the targets, a new quality procedure was introduced to ensure that work to a high standard was maintained.
Uprooting such a long and well-established practice and literally turning it on its head seemed counterintuitive, but we had a belief that it would work. So prior to the live run, we actually trialled it ourselves to ensure that the target was achievable. We then engaged the whole department, maintaining an open two-way communication with appointed coordinators in each area so they could troubleshoot any little niggles and iron out the problems. All staff groups were affected by the change. The Secretariat, Specimen Reception, Neuropathology, Cytology, and even the pathologists have all made an enormous contribution by reassessing their priorities and processes to allow for the scheduled workflow. And with such a large team to consider, we really didn't want to lose anybody along the way. So we realised that our clear communication was critical to the process. We annotated the exact details of the redesigned workflow and disseminated the information at a whole lab meeting, giving individuals their own reference copy. We also posted laminated copies throughout the lab to act as aid memoirs, and the secretaries devised their own macro tray for organisation. Technical dashboards were introduced, and these have proved to be a really good motivational tool both for the team and the individuals now working against the clock. And many staff have told me that they feel a greater sense of achievement and it has increased their job satisfaction. Our laboratory manager publishes the weekly results by email and on the departmental board, together with a congratulatory message or a note of encouragement. This evidence of our collective effort has truly brought a sense of unity across the whole department. And so, as we move on into the future, we continue to manage the workload on a daily basis, reconfirming the logic behind the change to ensure that we don't revert to our old practices and that we remain fluid to further improvements.
So after all the change, how did we do? Well, that is the graph of our new turnaround times. The 3-day turnaround time is now at 50% recommended national level, whilst the 7 and 10-day turnaround times are both below 90%, exceeding the Royal College recommendation of 80%. What did it do to our backlog in the lab? From 500 cases, it has reduced to nothing. That is the overall turnaround time in the lab, and cancer cases are clearly part of that. But let's look specifically at what he did for patients on the 18-week cancer pathway, of which 2 weeks can be allowed to turn cases around in the laboratory to meet the target. This is the number of breach cases per week for 18-week cancer patients, going back to 2009. The system was completely out of control, with many breaches on a weekly basis. But if you look at the far inside of the graph, after the change was introduced 6 months ago, we are now consistently meeting our target for the 2-week wait cancer cases. Yes. To make it personal again, this is basal cell carcinoma of the skin, the most common cancer in Caucasian people. But if there is a delay in diagnosis and treatment of this cancer, it can have rather disfiguring and disastrous consequences. This again is the number of basal cell carcinoma cases that we do not manage to report in 2 weeks. And you can see that there is a 200% improvement since 2007 up to the current status. How much did it cost us? Not a lot, to be honest. It was completely cost neutral. In fact, the change was delivered despite a loss of staff and a 23% overall reduction in staff. So we are doing more with less. How easy would it be to spread? I would say moderately easy if laboratories follow good lean principles. The most difficult task would be to convince the staff that the change is necessary. So to summarize, we devised an innovation that ensures flow through the laboratory by implementing lean principles. This resulted in an overall improvement of turnaround time whilst quality was maintained, but there was a dramatic improvement in the turnaround times of cancer cases. The key to this success was involvement of the whole team at every level, and that is the team who made it all happen.
Very good. Thank you very much indeed.
Thank you.